Another area you're looking at for head and neck cancer patients is a kind of dermatitis we get on the neck. Can you explain why there's a risk of dermatitis on our neck or other injuries to our neck from radiation, and then what your research is about?
Yeah, absolutely. So obviously, like I said earlier, with the off-target effects of cancer treatments, radiation, as effective as it is at targeting those cells, it doesn't discriminate between healthy and non-healthy tissue. And so when you're getting direct radiation to the head or neck region, essentially it has to travel through healthy tissue before it reaches the cancer itself. As a result, that sensitive skin and that especially on the neck region, which is incredibly thin and sensitive, essentially it can be thought of like a really severe sunburn. Obviously, with the sun, we get those UV rays. Similar with radiation, it is obviously radiation directly at that sensitive skin. So as head and neck cancer patients are receiving their radiation daily, it's essentially like a long and gradual build-up of that radiation targeting that area.
And so my experience of it was I basically got a deep sunburn and then I peeled. I don't remember exactly when I did peel because, of course, they give you wonderful pain relief. So I was on major opioids and I didn't suffer pain, but I was in a sort of a daze in the last week and the following weeks until my opioids wore off and I could reduce them. So I just want to reassure anyone facing this treatment, they do manage our pain. But I did see some men who had drier skin than me actually open up a bit and bleed. So it can be quite a challenging thing, yes, dermatitis to the neck, can't it?
Absolutely. So as much as it can be incredibly uncomfortable. It obviously, individuals experience it to different severities based on skin type and things like that. However, it can be incredibly painful, especially, like you said, when it starts to crack and open up and bleed. And at that point, it does become a serious risk factor for one, infection, as it is an open wound, but also just for delays and interruptions in treatment, along with any of these side effects. And largely why, as much as it's for that quality of life, it's also a really important thing to manage well so that it doesn't lead to those interruptions. And radiation-induced dermatitis can be a big one, as really the only way to prevent it or improve it is to just pause radiation.
So what is your research aiming to offer to assist these patients?
Absolutely. So what we're looking at is a way to essentially protect the skin whilst still preserving the effectiveness of the radiation. So not to shield it per se, but to prevent some of that severe damage. So what we're looking at specifically is a compound which is derived from the feverfew plant, which is a part of the daisy family. And this compound is called parthenolide, which has had really promising preclinical, so that means just lab-based research, which has shown really good promise in protecting healthy tissue while still allowing the radiation to effectively target those cancer cells.
And tell us what you're doing with the patients who are going to be part of this trial.
Yeah, it is quite a unique study, which we're really excited for, as it has a lot of promise. But in this, the nature of head and neck cancer, and especially in those receiving bilateral radiation, so that's in patients which receive radiation to both sides of the head and neck to a similar degree. So what this allows us is for the participants to act as their own control. So they'll receive both the interventional lotion, which contains the parthenolide on one side of the neck, whilst they receive the base lotion on the other. So that way we can directly compare them to themselves, which with human beings being unbelievably different, it allows us to have a really tightly controlled study.
It's amazing. And sometimes I love the idea we might be able to help head and neck cancer patients with a daisy.
Yeah. The DAISY project, as some have called it. And what is even more exciting for us is everything about this study is been done here in SA. So from the extraction from the feverfew plant all the way to applying this lotion to these participants. It all takes place here in Adelaide. So yeah, it's an incredibly exciting project, given that especially something like radiation-induced dermatitis, currently the only thing for these patients is sorbeline, which is just a pretty standard moisturizer, where it's a lot more complex than that.
That's fantastic.